Welcome everybody to our webinar. Thanks so much for joining us today. Our webinar today is State Medicaid and Education Standards for School Health Personnel. Thank you so much to everybody for taking the time to join. We're really looking forward to digging into this topic with you all today. My name is Alex Mays, and I'm the National Program Director at Healthy Schools Campaign, which is the organization that's hosting today's webinar. And for anybody not familiar with Healthy Schools Campaign, we are a national nonprofit, and all of our work sits at the intersection of health and education. And we really work to make sure that all students and staff have access to healthy school environments that support their success. And core to our organization's work is supporting states and school districts in leveraging Medicaid funding to expand access to school health services. And that's really the topic that we're going to be digging into today. And specifically, we're going to be focusing in on looking at the alignment between state Medicaid and state education standards for school health personnel, and looking at how state education and Medicaid agencies can really collaborate to make sure that all qualified school health providers are recognized as Medicaid eligible. Next slide. I just want to give a shout out to folks who are joining today from the Healthy Students Promising Futures Learning Collaborative. A core focus of Healthy Schools Campaign's work around school Medicaid is providing support to states and school districts around expanding school Medicaid funded health services. And that work we really do through our 15-state learning collaborative. And the states that are participating in that are in green. And many of the lessons learned that we'll be sharing today build on the great work that they're doing through that learning collaborative and in their own work. And we'll hear from Nevada, who is a member of the learning collaborative, later on the session. Next slide. Just a few housekeeping items. Our webinar is being recorded. We'll make sure that the recording goes out to everybody at the end of the week, along with a link to the slides from today. All attendees are also on mute, but you can chat the hosts and panelists using the chat feature if you have any questions or technical issues that come up. And we also encourage you throughout the webinar to send in your questions using the Q&A box on Zoom webinar. We'll be collecting those questions, and then we'll be saving the last 10 minutes or so at the end of the webinar to ask those questions of our panelists. Next slide. I want to just briefly acknowledge our supporters of this work. Their funding and engagement makes hosting webinars like today's possible. They're listed up here on this slide, and we just greatly appreciate their ongoing support of this important work. Next slide. So today we're going to really dig into work that Healthy Schools Campaign has been doing in partnership with Aurora Health Group around understanding the landscape of school Medicaid programs. And through our work, through Healthy Schools Campaign's work, we've really seen states and school districts across the country investing in school health programs to support the physical and behavioral health of their students. There's significant momentum building to strengthen and improve school-based Medicaid programs, to recognize the important work being done by a wide range of school health professionals, and to really ensure that sustainable funding is available for the services that they're delivering. And so at Healthy Schools Campaign, we really wanted to better understand that landscape, and particularly understand how states are integrating school health professionals within their school-based Medicaid programs. And so over the last 18 months, we've been working with Aurora Health Group to do an analysis of how state school Medicaid programs cover Medicaid covered services and Medicaid qualified school nursing and behavioral health personnel in all 50 states in the District of Columbia. And we really hope that this analysis will enable state policymakers, school districts, advocates, and other key stakeholders to better understand their state school Medicaid programs and really identify those strengths and opportunities for improvement. And so we're excited to dig into this analysis and work with you all on this webinar today. We're going to kick things off with just an overview of that momentum around school-based Medicaid that was building before the pandemic and really has continued through the pandemic. And then we'll spend the majority of our time really digging into the analysis of state Medicaid and education standards for school health personnel. And then we are thrilled to have members of our Nevada Healthy Students Promising Futures Learning Collaborative team with us to share more about the incredible work they've been doing around their school Medicaid program, and particularly the fantastic cross-sector collaboration that they have in place to support this work. And again, we will save time at the end for Q&A. Next slide. And so we have a great lineup of speakers for today's session. As I mentioned, we have representatives from Nevada Medicaid and Nevada Department of Education joining us. Gladys Cook and Rosanna Dagdagan are with the Nevada Department of Health and Human Services. Christy McGill and Pat Sanborn are with the Nevada Department of Education. And then we're joined by Stacy Weeks and Julia Smith with Aurora Health Group. Next slide. So just to kick things off, we wanted to provide a brief overview of the momentum that has been building around school Medicaid and some of the key trends that we're seeing, so we can really understand kind of the broader context within which this analysis was done and where there can really be some opportunities to move forward the best practices that were identified. So increasingly, schools are being seen as just a critical site for delivering school health services, and Medicaid really being recognized as an important funding stream to sustainably support that work. Research shows that Medicaid-funded school health services can support both health and academic outcomes, including improved attendance. Students with access to health services are more likely to complete high school, and there's also a positive impact on healthcare outcomes, including reduced ER utilization and improved access to quality of care. And we know Medicaid-funded school health services can also play a really key role in supporting more equitable access to school health services. Data shows that students attending schools in low-income communities are less likely to have access to full-time school health providers. And so school-based Medicaid programs can enable school districts serving student populations with a high percentage of Medicaid enrollees to draw down additional sustainable funding to expand access to school health providers. Next slide. And so given kind of this increased recognition of the critical role that school Medicaid can play in supporting both health and academic outcomes, we've really seen a lot of momentum building across the country around strengthening school-based Medicaid programs and really recognizing schools as the site of healthcare service delivery that they can be. And so some of the trends that we've seen that reflect that momentum include states expanding their school Medicaid programs to include all medically necessary services, not just those included in students' individualized education programs. All 50 states have school Medicaid programs, but historically, those programs have just enabled school districts to bill Medicaid for services that are included in students' individualized education programs. And there was a 2014 policy change that opened up the ability for states to allow school districts to bill for any medically necessary service delivered to a Medicaid enrolled child. So it creates a really important opportunity to draw down additional sustainable funding for school health services, and particularly for supporting the delivery of behavioral health services. And then another key trend we're seeing, which is really what is going to be our topic for today, is states doing really thoughtful work around looking at the qualified health providers who are delivering services within schools and making sure that they're Medicaid eligible and that districts can be receiving reimbursement for their time. And that requires really strong collaboration between the state education and state Medicaid agencies to do that work. Next slide. And so we were thrilled to really dig into that specific issue with Aurora Health Group. And one of the main questions that we get asked in our work is getting questions from school districts, from policymakers, from advocates, wanting to understand who the Medicaid eligible providers are for school health services within their states. And so we worked with Aurora Health Group to do a 50-state analysis and really better understand that landscape. And they'll, in a moment, dig much more into the findings and the key trends and opportunities that were identified through that work. We are also thrilled to share that we were able to take the data that Aurora Health Group pulled and create an interactive map on all state school Medicaid programs. Next slide. And so we'll be sure to drop these links in later on in the webinar to share these resources, but we just wanted to highlight this new tool. And I will just take a brief moment to share my screen. Let's see. And just to show you all this new interactive tool, which we're really excited to share. I mentioned that there are 16 states that have expanded their school-based Medicaid programs. the interactive tool shares those 16 states. You can click on the states and access more details about the policies behind those, the expansion of their school Medicaid programs. And then the most exciting piece, again, really builds on the fantastic work that Aurora Health Group did. And we now have data that shows the Medicaid eligible school nursing providers and behavioral health staff in each state. So you can click on a state, see those school nursing providers, and you can do the same for the behavioral health staff. And then there's a whole wealth of information in drop-down menus below the map, which includes more information about eligibility and coverage and more information about those Medicaid eligible providers. So we will drop these links in, I promise, and share these new resources that we're really excited to have, but we wanted to showcase that as a tool that can really help you all understand the Medicaid eligible providers for delivering school health services within your state. So Stephanie, let's go back to the slide deck. And with that, I will go ahead and introduce our first speakers from Aurora Health Group, who we're just thrilled to have here today to share more about the research that they've done. We have Stacy Weeks, who is the principal for Medicaid Transformation and Financing at Aurora Health Group. Stacy has spent a significant portion of her career providing strategic policy and legal advice and guidance to state and local governments, state legislators, healthcare providers, and nonprofit organizations on ways to improve access to care through the Medicaid program. And we're also joined by Julia Smith, who serves as Director of Medicaid Transformation and Financing at Aurora Health Group. And Julia supports state government, nonprofits, and other public and private sector clients by providing policy and legal research and analysis, strategic advice, and broader policy support in a variety of areas. So it's been wonderful to partner with Aurora Health Group on this work, and we're excited to hand it over to Stacy and Julia, who are going to share more about their analysis and the key trends that they identified through this work. So Stacy and Julia, I will hand things over to you now.
Thank you, Alex. That was a great introduction about Medicaid and schools, and also just the importance, I think, of the research. We're excited to be here and very honored to actually have gotten to do the work for this project. It was a lot of work, but it was definitely worth all the effort. Next slide, please. So just a little bit before we dive in, a little bit about our firm. A couple of years ago, you might have known us as Harbage Consulting. It might have only been a year ago. My timeline is a little fuzzy with COVID, but we recently changed names to Aurora Health Group. So same company, but just different name. We're a mission-driven and women-owned consulting firm, and we focus primarily on Medicaid. We did recently add an expertise area on Medicare. And we also have a team that really focuses on behavioral health. So we have a variety of different teams, but our primary focus is helping low-income populations get access to healthcare. We do work with clients that we believe enable us to stay true to that mission. That's the one thing I think we really, Julie and I both, I can say, enjoy about our company. We have offices in DC, Minneapolis, and Sacramento, but we're kind of all over the country and remote. So we're in different areas of the state or country, sorry, not state. Next slide. So let's talk a little bit about the report and sort of some of the foundational pieces I think will be helpful. So when we first talked to Alex and Lena and others with Healthy Schools, we heard a lot from them about just this idea that schools are facing issues when trying to get Medicaid reimbursement, specifically for services that already are covered, right? So it's not necessarily about adding new benefits. It's not necessarily about eligibility per se for students. It's really about we're billing for what we think is eligible, but we're getting denied, or that's what we're hearing schools are experiencing. And it seemed to really come back to all these differences around school health personnel qualifications. So that's sort of where the conversation started. And really trying to understand if there are differences between the state Medicaid agencies and state education agencies that have kind of been put out for a variety of reasons and purposes that may actually be impacting probably most of the time unintentionally, the billing of Medicaid. So in doing the research, there are a couple of goals that really came forward from Alex and her team, and we focus on, because of the time and obviously the effort that goes into looking at state plans and all the other information online around Medicaid coverage in all 50 states, Alex asked us to focus really on nursing services and behavioral health services for this research, which was really great because those are two, especially with COVID, that really felt that kind of came to the forefront as being really important for schools. And then also determining, we looked at, what are the types of personnel being used for these types of services who are deemed qualified for Medicaid reimbursement in each state. And then we looked at that information and did our best to compare it to what we call state education standards. In some states, it could be other types of standards, but any kind of standards in state law that really govern who can provide school-based health services to students, because there are different types of standards and requirements for certain personnel in the school system. And in the report, you'll find, we did 50 state review and we identified what we call areas of alignment and misalignment between these kind of state education standards and Medicaid. We also, like Alex was showing you, the interactive map, that is in there. That was a lot of the information we found in our research, so that kind of was nice. It actually populated all of that, which was great. Always want to note that things change, and I'm sure some of that information has already changed. So Medicaid is always a living organism, so be sure to always double check, but that information is pretty recent over the last year. We also found in our research what really kind of stood out to us as promising practices in terms of specifically around billing Medicaid and the provider qualifications. And then we also put together several recommendations as we looked at ways to really improve access to billing Medicaid for school-based services for school systems. Next slide. So there are two questions that we really kept coming back to as sort of driving the research early on, was really this idea, are there differences, right, between the Medicaid provider qualifications specific to reimbursement and the state standards that really govern the types of personnel that can operate in the school system? And really, are those two operating in a way that might negatively affect the eligibility of the schools to be paid and by Medicaid? And if so, that in our minds, that's really serving as a barrier. And if we didn't think it was serving as a barrier, there could be a difference, and it may not, may be small, but in some instances, sometimes those differences do not affect the Medicaid reimbursement side. So we would not really see that as an issue. So we're really focused on, is there a difference here that affects Medicaid reimbursement? I wanted to note early on that schools here don't really, in this research, did not encompass school-based health centers. That in our minds is a whole nother, kind of research and focus. This is really about services provided by providers in the school setting, and not the school-based health centers themselves. And also, in other words, it's really looking at that local education agency or the school district in each state. Next slide. And so in the research methodology, just to kind of let you guys know what our process was in digging into this, we really wanted to come at it from if we were a school who may not necessarily have a direct line to a state or a parent or just someone trying to understand what is covered. So instead of interviewing every 50 state, we really took it as we want to go and see what's publicly available as much as we can to really get a sense of what it's like to really understand Medicaid for schools and provider reimbursement. So we started out with state Medicaid plans. We did do requests for some states that don't provide that information online. So that is a caveat there to our goal and trying to really look at it from an outside external party. We did look at provider manuals, which I would say is also a really important tool. If you haven't looked at one of those, it's a good place to start. State statutes, agency guidance, regulations that were, both on the Medicaid side and the state education agency or any other agency that governs these school-based personnel. And then we did want to point out a couple limitations to the research. Obviously, like any research in Medicaid, it is time-stamped, right? So you want to go back and make sure that you always look to see when the research was done, because things can change and things can be updated at the state level. And we really, like I said, limited it to publicly available information. And we did not survey state officials directly unless, and I'll talk about that in a minute, unless they reached out to us in response to our findings. We did not include changes. There were lots of things that schools were doing around coverage and reimbursement that had to do with COVID and waivers. And we just felt, that was just sort of outside the scope at this point. But so that's not included in this research. And we didn't include ABA services only because ABA services were not always categorized as behavioral health. You know, in some states, they sometimes fell in a different category. And so for us to actually make sure we were being true to and looking for that, we were really having to go outside our scope to really understand ABA. So that piece, I think it's important to note that it's not something we explicitly went in wanting to exclude, but it just made sense from a research perspective of where we were looking. We did send emails to states to get feedback after we came up with the findings, especially for the information on the map. Obviously with COVID and, you know, and capacity, a lot of states are busy. We heard back from about a dozen. You know, and, you know, we are continuing to work with Alex as she gets feedback from a variety of different folks or questions to make sure that information is updated, and we remain partners in that going forward. Next slide. So to organize the research, we decided to kind of group every state or sort of these based on nursing services and behavioral health services in the state into three sort of groups. One is, you know, let's say, for example, I'll give you an example for like state A for nursing services. We may have found in a state there, we found it appeared to be alignment, which meant that really we found no differences at all. And if there was a difference, it did not impact reimbursement, or there was not a potential to impact reimbursement. Again, we don't actually have evidence. We don't know for sure, but we're assuming that it could be used to deny reimbursement. You know, so in those cases, those were kind of our star states, right? Like, okay, we're good on that topic. And sometimes it would vary between services if they landed in that bucket. And the other option was there was misalignment. And when we tagged someone with misalignment, not only was there misalignment, but we thought there was a potential issue for billing for a school that might bill, and that difference would affect their ability to be paid. So that would be the bucket for those states. And then the third bucket was a lack of clarity. As you guys can imagine, like anything, things get outdated, information can be a little confusing. It's Medicaid, it can be complicated. And so there were instances where, as if we were taking it from an average external party looking in, trying to understand what it might be like for a school district or a parent or provider, it was really hard to understand whether or not coverage or reimbursement was available, or what the rules were at all when it came to, let's say, provider qualifications beyond just the simple title that was in the Medicaid plan. Next slide. Thank you. Next slide. All right. So we're going to dive into the findings that specific to school nursing services, and there's definitely more in the report. You know, this presentation could have been longer for I didn't really in depth, but I definitely want to refer you to the report if you're interested in some of the other stuff here around school nursing services. But I think all of you probably know that all state Medicaid programs really do pay for RNs. I think that is something that stood out to us. In most states, that includes also licensed practical nurses, LPNs. So, you know, those are kind of usually the two general types of providers that are covered for school nursing services. What was interesting and stood out to us in the research was really this idea around covering designated services, especially when a Nurse Practice Act, for example, in a state says nurses can delegate services in the school system. And let's say they do, and then the Medicaid program did not necessarily include that, right, in their qualifications or eligibility for coverage. And so if that's the case, there, you know, that could be a problem for billing. And we found that about half of state Medicaid programs don't even really address that issue. And so they're not clear on this topic, and, you know, and that can be a problem, I think, for schools not knowing whether or not these services are going to be billable to Medicaid. And that was the case when the scope of practice, the state Nurse Practice Act permitted delegation. So we definitely want to note that in about half of those states, there was no guidance around that. And I think, as you guys can imagine, you know, Medicaid reimbursement for services delegated by RNs really helps extend the reach of a school and the reach of the state, right, to help support the needs of students. And sometimes, especially nursing services in rural areas of different states are in short supply. So this is something we thought was a really important piece to highlight in the report. Next slide. And then the other, you know, on the other topic of school-based health services, we found that nearly half of states show misalignment between state Medicaid provider qualifications and the qualifications of the state education agency for school-based behavioral health service providers. You know, it wasn't too much of a surprise to some of us, especially if you've, you know, watched Medicaid over time and behavioral health kind of evolve and move into a movement with Medicaid and become covered in the ACA. So it wasn't a surprise that there was some misalignment there. And, you know, I think states are still growing and redesigning their behavioral health programs in Medicaid as we speak. So that wasn't a surprise, but I think some of the things that went along with, which we'll dig into in a minute, the reasons why the misalignment was very interesting. I think is important to really think about as strategies in solving these problems for students and schools. A good example of this misalignment could be, for example, in state X, there's a, you know, there was a couple states like this actually, where a certified school psychologist was permitted to provide psychological testing, counseling, therapy-related services in the school setting to students. But the Medicaid program would only pay for schools for these types of services when they were provided by a licensed psychologist. Now, the issue there was that not all school psychologists were licensed or required to be licensed by the state for a variety of reasons, right? Access issues and other things. And so the state only required a master's degree, for example, and the certification by the state agency for education. And in those instances, you know, those individuals that were school psychologists would not be eligible for reimbursement because of that misalignment. Next slide. So this one might be more interesting if you're interested in digging into that topic. And also there is some piece of this, I think, for nursing services as well. I will say most reasons for misalignment really is around behavioral health, and the majority of misalignment for nursing services was around that issue I mentioned earlier, the delegation and Nurse Practice Acts, and whether or not Medicaid recognized the scope of practice, you know, explicitly around delegation. But when we look at most states and the most common type of reason, or most common type and the reasons for misalignment, what really stood out to us was this special certification program. It was designed to permit the practice of certain school health personnel that are not recognized by the state Medicaid program. So in those instances, like I mentioned earlier, that example of state X, this would be that state. So many times state education programs are trying to certify as many school personnel as they can, but they may not necessarily match what we in Medicaid, or if you work in Medicaid, might perceive as a healthcare provider, right? And a professional, that there's a unique professional for schools, you know, there's a unique requirement. So there's some disconnect there. And that was in about 20 states. There were states that got around this issue, and we'll talk about that in a minute for promising practices. So I think a lot of times in Medicaid, we think, you know, it is true in most instances people need to be licensed, but there are ways to still cover and reimburse for these types of providers. And in about 12 states, there happened to just be a broader list of school personnel that were permitted by the state education agency to provide student health services than those recognized by the state Medicaid program. And then, you know, we could only guess, but in some of the states it made sense because, you know, sometimes things get passed into Medicaid in a state plan amendment, for example, which is a process to go through the federal government. And state education agencies are, you know, commonly expanding the types of services, especially in behavioral health and for students. And the Medicaid program in that instance has not really, you know, expanded its list. So that disconnect there, though, can really impact schools' ability to be reimbursed for those services. And then, you know, a smaller number of states, but I still think the impact is important, especially as we look at access and trying to really address workforce issues in the school settings, is this idea of some states do not cover provisional or temporary licenses in Medicaid for school health personnel. But the state education agency or state law in general says that these individuals can practice in the school setting. So school may be permitted to hire them, and they may need to hire them for access issues, but the state Medicaid program hasn't quite, you know, updated that list on their end, or may not feel that they can cover it under the authority that they're using. So in this instance, billing for Medicaid would be difficult. And the last two examples here are smaller numbers of states, but I think important to point out, you know, there was one state in particular that really I think of on this one. There was they just had a really rigorous set of Medicaid requirements around the school health personnel that went way beyond, you know, the state standards in terms of licensure, masters, that type of thing. It went on to say you had to have, like, for example, 2 years of special experiences with children and behavior, whatever the topic was. It read much more like a job description. And in many ways, while there's, you know, obviously there's reasons for that and good intent. If a school was unaware of these additional requirements of having to have hired people with certain levels of experience, expertise, PhDs, you know, they would not be reimbursed. So even though the services were covered. So I think that's an important area where alignment is really important with the state education agency. The other one here has to do, this last one has to do with, you know, a lot of schools are moving to hiring contract personnel to help fulfill some of these services. And as they're doing that, Medicaid in a few states, just a few, did have explicit restrictions on paying for those services or how they paid for them. For example, they may only pay for them for a limited number of months or a time period and would not fully cover them. So that could be a barrier for schools too in supporting these services. Next slide. So when we looked at this research, we thought, wonder how the states are doing that have expanded have expanded student eligibility for Medicaid, right? So we know that, like Alex said, over a dozen states have expanded student eligibility for Medicaid. And so we wanted to look specifically at those schools, you know, as their own kind of cohort. And the good news is that these states were more likely to have a finding of alignment here. So hopefully, as schools are building for all these new students, there is more of a chance, like higher chance that they are getting reimbursed. You know, that's something to think about, that, you know, there's still work to be done. I will say where there was misalignment, it was just what, like we saw with nationally, and that misalignment was most commonly found in the area of behavioral health. So between education and Medicaid programs. And there was also this finding of unclear or lack of information around this delegation issue for schools who may not be able to hire a full-time RN and maybe are doing delegation. So that's something we just wanted to make sure, you know, as schools are expanding, to think about some of that alignment between provider qualifications. Next slide. And then there were, so like I said, when we were looking at it, we did see some really interesting, promising practices among states, which is always important to share, right? We can always find problems. So as we're thinking through, like, this idea of, like, okay, there are good things here that states are doing, you know, and Alex and her team are really wanting to share some of the more positive, you know, things that states have done. So these, I think, really stood out to us. And digging through all the material and information. For example, the one I think seems very basic, but is so helpful, is just having clear, up-to-date information about the types of providers and services covered in the school setting. You know, and the other piece is sometimes states not only had that, they also had clear coordination with that education agency that really not only made it easy to find, right? Because you're going to find it on one side or the other or from an agency, but also it was nice when the information did not conflict, because sometimes we did see that. And so what we really found to be helpful is when we was really noted that there was a joint manual, for example, on school-based services, and that had been up-to-dated regularly. With clear intention that these two agencies or entities are coordinating. We actually did not ask them, but we assumed, right? Visually, it appeared to us that they were very much coordinated. And so that is a very important, promising practice. The last piece is, you know, Medicaid pays for the services of, and these are the ones I think really get back at what I was talking about earlier, the types of misalignment. So ways schools have addressed these issues, or states have addressed these issues. So for example, around this special certification program, some states have gone as far as making sure their Medicaid program pays for health personnel always approved and certified by their state education agency to work with schools, in addition to the licensed psychologists and, you know, et cetera, but also having that fallback category in their state plan to be broad enough to capture additional providers the state deems authorized and qualified. This other bucket was of things that we thought were super helpful, that we found that other states have come up with ways to think about how to pay for behavioral health professionals that are paraprofessionals, right, that work under the supervision of licensed professionals, and not just stopping with the licensed professional, but finding ways to cover these individuals. Also, nursing services that have been delegated by an RN pursuant to the state's the Nurse Practice Act. Some states were very, very explicit, not only at the education level from the education agency. Again, there's that coordination where they say, hey, can allow their RN to delegate, and the Nurse Practice Act in our state, you know, says that these RNs are qualified to do that. But the Medicaid program also explicitly said these services are covered. And in our mind, regardless of your, you know, do not or you do cover it, it's important to let schools know so they have, you know, some ability to plan on their end. Next slide, please. And I'm going to turn it over to Julia from my team to carry on the ends of this. Thanks, Julia.
Thanks, Stacy. So here we just wanted to highlight what we've seen as some of the positive developments in coverage of school-based Medicaid. Again, this is reiterating many of the themes that Stacy touched on. One is expressly covering the services that are provided by lower level professionals or unlicensed individuals who have been delegated that responsibility by licensed RNs or the school nurses. You know, again, we see that as a really critical way to extend the services of school nurses, where, for example, one school nurse may be required to cover a very large school. There are certain tasks which the state law appropriately recognizes can be delegated to unlicensed individuals, such as medication administration, for example, that with proper guardrails, supervision, regular check-ins, verification of the unlicensed person's qualifications to provide the service, that's a really easy way for states to sort of extend the reach of their school nurses. So we see 15 states are clearly doing that. Another one, this again, one that Stacy highlighted, is expanding access to behavioral health by covering the services of school counselors, school psychologists, and school social workers, or those school personnel that are certified by the state education agency as qualified to provide behavioral health services in schools, but who may not meet the qualifications that otherwise apply under Medicaid. So for example, it may be the case that in a mental health clinic, in an outpatient mental health clinic, the Medicaid program says you must be a licensed psychologist to provide certain services. In the school setting, because school psychologists are certified by the state education agency as qualified to provide those services to students, we see that as sort of a great way to address what may otherwise be an insurmountable challenge to providing adequate behavioral health professionals to serve students in schools. Stacy, do you have anything to add on these 2 points?
No, I think that's good. Thank you.
You could have the next slide, please. So a few more. One is we see 7 states now covering substance use disorder services by covering the services of alcohol and drug or addiction counselors. You know, I think everyone would agree that this is the need for substance use disorder services is significant, including in our middle and high schools, and making sure that we really have those professionals in the schools and that the Medicaid agency recognizes them as qualified to provide services in schools is a great way to expand access to those services. We see 11 states extending the reach of their behavioral health professionals by covering the services of behavioral health paraprofessionals working under required supervision. So again, this is really comparable to the RN delegation context, where we're saying that lower level professionals can provide certain kinds of behavioral health services under appropriate supervision, and that's permitted under state law, and to address provider shortages and extend the reach of schools' behavioral health professionals, the Medicaid agency and the state education agency can come together to say the services of those paraprofessionals are reimbursable by the state Medicaid agency, provided that certain requirements are met, such as adequate supervision. Finally, we found 7 states that are really taking strong action to address provider shortages by covering the services of professionals with provisional or temporary licensure. So that would be, for example, someone like a master's degree social worker who is on her way to becoming a certified school social worker, maybe has not met a certain hourly requirement, or is in the process of studying for a certifying exam but hasn't passed it yet, that those professionals, where there are shortages, would be permitted to provide services that would be reimbursable by the state Medicaid agency, recognizing that they're qualified to provide services. We expect them to obtain permanent licensure. And in the meantime, we really need those services to get to students in our schools. Stacey, do you have anything to add on these three?
No, I think it's just, when I hear you talking about it, it does seem like the trend that we're seeing here is this move to as much coverage as possible right now to address access. It seems like all of these trends really are around access issues for personnel. I think that's the one thing to point out.
Yeah, and I would just add that on the RN delegation and supervision to, and on the delegation to behavioral health paraprofessionals, that the state Medicaid agency and the state education agency are only in these states certifying that as appropriate because, in part because state law, the state nursing law, the state law governing various kinds of behavioral health professionals has recognized that that's appropriate, that for example, registered nurses are qualified to delegate certain nursing services to lower level professionals and to supervise the provision of those services in a way that's appropriate. Next slide. So this provides a link to the one Alex provided previously that provides a link both to the report that we've been discussing and the interactive map, a great place to go and look for specific information about your state or other states that may be of interest. Next slide. So to recap here, the overall recommendations that we had coming out of our report, one, to expand Medicaid reimbursement for behavioral health services, including those provided by lower level professionals or paraprofessionals working under supervision. Providing reimbursement for a greater range of provider types, including those that may lack professional licensure, so may not be licensed psychologists, but are certified or approved to practice in schools by the state education agency. So there we're thinking of our school psychologists, our school social workers, our school counselors. Clarification by state Medicaid programs as to whether they reimburse for nursing services delegated by RNs to lower level unlicensed professionals. And ideally there, clarification that in fact those services are covered. And finally, adoption of all the identified promising practices and also coordination between the state education agency and the Medicaid agency to ensure that schools and school districts really have clarity on the state's coverage policy. Next slide. So here we just included contact information for me and Stacey. Feel free to get in touch with us with any questions or for any follow-up. We're always available.
Great. Thank you so much, Stacey and Julia, for walking through the incredible analysis. It was a tremendous effort that you undertook, and we really appreciate you walking through those findings. And again, we will share all these links with everybody as follow-up. So I am thrilled next to introduce our team from Nevada, who's going to share more about what their school Medicaid program looks like within Nevada. And they do an incredible job collaborating between their state education and state Medicaid agencies, which, as we heard from Stacey and Julia, is one of the best practices for really bringing these systems into alignment. So I'm going to go ahead and introduce each of the speakers as they, I'll have them come on video now. So we are joined by Gladys Cook, who's a social services program specialist with Nevada Medicaid and has over 20 years of employment with the state. Her background includes numerous years working in social services programs with Nevada's low income and uninsured population. And we also have Rosanna Dagdagan, who is also a social services program specialist with Nevada Medicaid and has worked with various social services programs in Nevada over the last 15 years. And then from the Nevada Department of Education, we have Christy McGill, who's the director of the Office of Safe and Respectful Learning Environment, and has been working on a system of care that holistically supports school staff and students for 4.5 years within the agency. And finally, we have Pat Sanborn, who is the Health and Wellness State Coordinator at the Nevada Department of Education's Office for Safe and Respectful Learning Environment. And she works with several collaborative groups, including Nevada Medicaid, the school mental health professionals, and school nurses to advance this work. So thank you so much to everybody for joining. I'll now hand it over to you to share the great work happening in Nevada.
Great, thank you, Alex, for that introduction. So next slide, please. So really quickly, we're going to cover just a few topics here. And everyone knows school-based health services, commonly named. However, in Nevada, we call it school health services. So within our agenda, we will cover what some of the school health services are in Nevada, our collaboration with the Nevada Department of Education, and next steps. Next slide, please. So I'm not going to explain the free care policy. Most of us in this group are very commonly, we understand, we know what the free care policy is. But with this slide, we wanted to show what it looked like before. So with the free care policy, before LEAs or local education agencies could only bill for services in a educational, individualized educational program, an IEP. With the free care reversal, remove this limitation, and LEAs can bill for medical services for any Medicaid enrolled students. So the charts below will give you just a quick glimpse, a visual of what it looked like before. As I mentioned, school provided medical services to all students, uninsured, privately insured students, and schools provided these services for free. With the free care reversal, schools provided medical services to all students, students with Medicaid, and schools can bill for Medicaid covered services. Next slide, please. And so the next couple of slides will give you a glimpse of what those current services are and the expansion services that includes non-IEP services as well. So I'll just give you a few minutes to kind of look over those. Next slide, please. So continuation of the services, some of those new services, or what we call, I should say, expanded services, are those personal care services, PCS, applied behavioral analysis, ABA services, dental services, case management, and telehealth services. For case management services, there are only 2 areas of targeted case or target groups that are provided that can be delivered in a school setting. And those are for children and adolescents who are non-severely emotionally disturbed, non-SED, and adults who are non-seriously mentally ill, non-SMIs. Next slide, please. And now I'm going to turn it over to Rosanna.
Thank you, Gladys. Yes, my name is Rosanna and Dagdagan, and I am a program specialist with Nevada Medicaid. So I'll be covering additional services that are available at the schools, and those are the early and periodic screening, diagnostic, and treatment services. And those include screening, vision, dental, and hearing services. EPSDT services are also known in Nevada as the Healthy Kids program. LEAs and SEAs are encouraged to provide EPSDT services. These are some of the services that LEAs and SEAs can provide without a plan of care, as long as the screening and diagnostic services follow the periodicity schedule as established in the Healthy Kids program, and that is under the Medicaid Services Manual, Chapter 1500. That's the part of the Medicaid manual for Medicaid services in Nevada. And those EPSDT services are determined to be medically necessary, screening when it falls outside the periodicity schedule. Next slide, please. And also, those services are documented in the student's medical records. So that will be the EPSDT services available here in for Nevada Medicaid. Next slide, please. So the next section I'll be briefly talking about is those LAA contracts. So in Nevada, we have 17 school districts. Currently, Medicaid has contract with 8 of those eight of those school districts. So here is a map that shows those school districts in Nevada, and the green areas within this map include those school districts that currently have contracts with Nevada Medicaid. And out of those 8 school districts, only 7 have amended their contract currently to include expanded services. And the shaded gray areas are those school districts that do not have a contract with Medicaid. The gray areas include the rural school districts. And the main reason why these school districts don't have contracts is because it's not cost effective for the smaller school district to hire a billing agent. Even though the geographic location looks, like similar or comparing size to others, the student population is low compared to the other school districts. So there has been some discussions with internal discussions with Nevada Department of Education about building a consortium for the smaller school districts to become school health services providers and to build Nevada Medicaid. And we will keep everyone posted on those updates as to, we come to find solutions or ways to have this school district enrolled to build Medicaid. And so that's all I have. And now I will hand it over to Pat Sanborn, who will go over our collaboration with Nevada Department of Education. Thank you.
Thank you, Rosanna. Really nice overview. And so I'm just going to talk a little bit about how we developed our collaboration with Nevada Medicaid and vice versa. And so I'd like to start with just giving you a little bit of background and history. So we started to meet with Nevada Medicaid through a partnership that we developed with the Division of Healthcare Financing and Policy back in 2016. And some of this early work was related to sustaining some of the federal grants that we were working on, specifically Safe Schools, Healthy Students, and then a little bit later on, a Project Aware grant, which really focused on school mental health and how can we sustain the work that we were doing in those federal grants without the funding that was coming in from the feds. So we began to meet weekly with people that were in the school health services staff. I believe Gladys was one of the initial people, and there have been several changes in their staff over the years, but as there were in ours. And so we have developed this really wonderful relationship with them. And currently we meet monthly, but back then we were meeting every week. And so over those course of meetings, we worked pretty tirelessly to build the access to school health services through the state plan amendment. And that was submitted, I believe it was 2019. Next slide, please. So how did we engage with each other? Again, with some of the past work that we did, we had a state management team, which was required through our Safe Schools, Healthy Students and Project Aware grants, but we've morphed into what we now call the state leadership team. And we meet quarterly with state partners and LAA partners. So we're all together, excuse me, in the same room. And we're talking about topics that are really of interest to school districts in sustaining some of the work that they're doing. And then concurrently, we meet monthly with the chief school nurses and also our specialized instructional support personnel, which consists of our school counselors, school psychologists, and school social workers. So through those collaborative efforts, we've really unified some of the work that we share and being able to sustain some of the school mental, not only our school mental health services, but our school health services with our school nurses. Recently, there was legislation that was put in place. I believe it's SB 151, if you wanted to look it up. It's online. And so one of the requirements of that law is that the school districts submit to the State Department of Education a plan for how they're going to increase the ratios of their school mental health professionals to students. So again, it's increasing access. And concurrently, we are working in order to have some of those services be reimbursed through state Medicaid for the behavioral health services that they're providing, as well as our school nurses. And so this will be the first year that they're required to not only submit the current ratios, but a plan for how they're going to get the ratios up to recommended as by their state associations. And I believe I'm going to hand this over to Christy now to talk a little bit about our MTSS process and how we also work to integrate some of these services.
Yeah, thank you, Pat. And go ahead, next slide. We'll finish up in a minute here. So what we really want to do is connect our Medicaid billing process to processes that are very familiar with the schools. One process in Nevada that most of our districts have been working on for several years is a multi-tiered system of support. And so really aligning what services in that system of support are indeed billable, very similar to some of the recommendations you heard in the first presentation. That's exactly what we're working on as well. So we really want to make sure that we are providing a holistic continuum of services, whether it prevention, intervention, or treatment, and have different funding buckets aligned with those services. So obviously Medicaid would take up tier 2 and tier 3 services, and educational funds would take up the tier 1. Next slide. We also looked at some legislation, and like what Pat said about SB 151, looking at ratios. The reason why Nevada really wanted to strengthen that piece is because without proper ratios in the schools, not only do services decrease for students, but we want to have plenty of time to collaborate with our community members. And so the last thing I just want to wrap up is that one of the collaborations we're really working on is with our hospitals as well. So not only are they billing Medicaid, but they can now bill Department of Education for continuing of education services. Again, a very holistic approach. So thank you guys. And last slide.
Great. Thank you so much to the Nevada team. I think maybe, yeah, move one more slide. I think their contact information is perfect. Great. So I know we are at time. We have had a number of questions come in. So I want to encourage everybody to send your questions in. We will be sure to address them. I did want to there was one question that was asked. I think that was a really good one that is for Stacy and Julia. And I think connecting the dots between what Nevada shared about their expansion and the work that was shared by Stacy and Julia. And just wanting to know, given the trends that you shared, for the states that have expanded their school-based Medicaid program, or for the state, were best practices seen also in states that did not expand their Medicaid, school Medicaid programs, if that makes sense. Okay, thank you, Stephanie. Yes, if you could maybe, Stephanie, if you could take the slides down and then just have us all in gallery, that would be great. So Stacy and Julia, the question is, you know, what were best practices seen in non-expansion states as well, and kind of speaking, and I think you answered it in chat, Stacey,
Yeah.
but not for everybody.
And I apologize, I don't have the map, and you know, there were best practices, I think, generally and nationally that we probably missed, but if I recall, there were states that were not necessarily all the way fully have expanded eligibility for students or free care policy. Because they're trying to address other issues. So yeah, I think it's across the board. It doesn't matter. It doesn't really mean that state has expanded student eligibility.
Great, thank you so much for adding that. That is really helpful. And we will be sure, again, the map has some of those best practices. And I guess just one question for the Nevada team, you know, given this wonderful collaboration that you all have, individuals who are in states that don't have this in place, you know, what would you recommend to them as far as engaging with their state agencies, and, you know, whether, or if it's somebody who is within a state agency and is looking to build that bridge to their cross-sector partners, you know, where would you recommend people get started?
I can take a stab at that. I think it's really important to take some time to develop the relationships with the partners that you're working with. And so, for instance, like I had said in my presentation, is that, you know, we've been working on this since 2016, and over time have finally gotten to the point, or have gotten to the point, where we are very comfortable around working with each other, and we understand what is needed in the state because we've had those shared discussions over the time. So I guess my advice is that you take the time to really develop those relationships, and don't just knock on somebody's door and say, hey, I want you to do this because we need it now.
That's great. Thank you for sharing that. Gladys, were you going to share a final thought?
No, Pat said it perfectly. Is exactly that, is coming to a common ground and just share. We all have a passion, and that's to help our students. And she explained it the best.
Great. Thank you so much. Well, with that, we're going to go ahead and wrap up our webinar. Again, we will send out all these links. Please do not hesitate to reach out with any other questions. A huge thank you to our panelists, to Aurora Health Group, to Nevada. We so appreciate you all taking the time to share the wonderful work that you're leading. And thank you everybody for participating today. Happy holidays, everyone, and we look forward to being in touch about this work.